Medical racism is real, and I just watched it play out right in front of me. A black mother came in literally about to give birth, like she could barely breathe through the contractions. And instead of rushing her to a delivery room, these nurses sat her in the waiting area like she was here for a routine checkup. I'm not kidding, this woman was doubled over.
Tell me why I saw a black mother about to give birth not in the delivery room, but in the damn waiting area waiting for a nurse to sort through the damn documents. This black mother came in clearly in active labor, like full contractions, barely standing, and instead of rushing her to a delivery room, the nurses told her to sit in the waiting area. The waiting area. I couldn't believe it. This woman was crying out, gripping the chair, literally screaming in pain, and the nurses were just ignoring her, acting like her suffering was background noise. They were chatting, sorting paperwork, moving at the slowest pace imaginable, while this poor woman was basically about to give birth right there on the floor. She sat there for over 30 minutes.
Dallas Regional Medical Hospital, Mesquite, Texas. Everybody needs to share this video. Black women are not treated fairly. Black women are not treated equally. This is insane and inhumane, and it must stop.
I just watched something that absolutely disgusted me. As a former ER nurse and a current labor and delivery nurse, I usually try to seek the best intent of a nurse. Not today. Not today. Because barring you having a medical emergency yourself, where your legs, your arms, and your voice no longer work, there is zero excuse for the blatant neglect that I just watched. And as a reminder, Black women are 3 times as likely to die in and around childbirth than their white counterparts. Part of that is because they are not believed about their pain. How you can sit there on the computer and act like you don't notice that this woman is actively birthing beside you is crazy town to me. Unacceptable, inexcusable. And if you've got coworkers who you watch do something like that, you are just as culpable.
Oh yes guys, welcome back to the channel and I hope you are all doing good. This is a shocking and heartbreaking incident in Dallas Regional Medical Center, and it has the entire nation talking. A white nurse has officially been fired and had her medical license revoked after being accused of mistreating, ignoring and neglecting a black woman in active labor. Just as you have seen guys, this is leading to a lawsuit that has shaken the hospital system to its core. So that is why I decided to make this video, so that I can get your opinions about this. What are you saying about what really happened inside this delivery room, the disturbing details of the nurse's alleged negligence, why the family decided to sue the hospital, and also how the hospital responded. Guys, let's get into the broader conversation about medical racism and the dangers black women face in the United States healthcare system. Yeah, so guys, let me get your community reactions and also the calls for justice. I'll be back.
And that abuse went on for a while. And I say abuse because it is abuse. And when we know that black and brown people are 4 times likely to die today than me and my color, this is totally disgusting behavior. But let me tell you something. This happens way more than we talk about. This mom was clearly having a baby, was just ignored. I have also had clients ignored. I sat in an ER with a client, a black mom, who was sitting on her ball for more than an hour. And I would go up to the desk about every 10 minutes or so and ask what the problem was, that she was actually in active labor and no one cared, and why she's gone on to have 2 home births. I'm not saying to have a home birth. I'm saying that systems need to pay attention to how they're treating people, because this is one of the reasons why people feel unsafe and are having out-of-hospital births. This mom ended up standing up, turning around in the wheelchair, and then had a baby not too long after that. There are some people who do not need to even enter the doors of healthcare.
Screaming, begging for help. And the nurses acted like they couldn't hear her, just walking around, shuffling paperwork, talking to each other like nothing was happening, completely oblivious, or pretending to be. And she sat there for over 30 minutes, suffering, shaking, crying out, while everyone ignored her.
When's your due date? Right now. Is your due date 11?
Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
Beverly, this is the first another patient for you. Alright, last name is Jones. She's G3P2. I'm not sure when her due date is.
Her due date is the 10th.
I think her due date is the 10th.
She had 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors. Everybody say how they treat people. Hey guys, I'm here with Mom and baby Cash. They are doing well. He has a doctor's appointment tomorrow at the pediatric center. It's a lot of concerns. They taking tests on him. He still have to go through several other tests down the line because he was born with his eyes open, and due to the stress and trauma that occurred in the triage area, the baby had a bowel movement in Mom, and the fluids was green, and like I said, he born with his eyes open. So they are, you know, taking all that in consideration as well. But he's eating well, sleeping well, looking good. And I was also reading a lot of the comments, and some of you under the impression it was twins. They are not twins. This is daughter with baby Cash, and this is other daughter with baby DJ. They are a month apart. DJ born 10-10 and KJ born 11-11. Thank you again for your support and your concerns, and we will most definitely keep you updated.
Whatever you're doing right now, I need you to stop and watch this video.
Fuck! When's your due date?
Right now! So you don't have to be an OBGYN. You don't have to have any medical knowledge to know that this woman is in distress.
Is your due date 11?
For those primal screams, not to invoke an ounce of humanity. Think about that.
What? How many times have you been pregnant?
Seriously, who gives a fuck? A baby's coming.
3! This is your 3rd pregnancy?
Yes!
You have 2 babies
It's
at
in
home?
my ass! 3rd baby, it's in my ass, means she's gonna have a baby on the floor unless she gets that woman to a room now.
You have 2 babies at home? Who's your doctor?
Lang is her doctor.
Let's talk about this Dallas video because it's not just bad behavior, it's dangerous, it's discriminatory, and it's why black women in this country keep dying. The young woman's in active labor, and clinically we all know that priorities shift. Intake stops, and your eyes should be on that mom and the baby. But instead, we're watching a nurse sit there asking frivolous questions while a black woman is clearly in distress, progressing, and not treated with the urgency and dignity that she deserves. It's not just rude, it's dangerous. It's egregious, and it's actually disgusting medical care. And I need y'all to understand something, that as a black OBGYN, this is not an isolated incident. This is a culture. And this is what happens when a healthcare system that is not designed for anyone outside the majority, this is how it affects and shapes the legacy and how black women are treated in real time. This is our maternal mortality numbers. This is how black women end up ignored, undiagnosed, untreated, and unprotected. It's a bias, it's systematic, and it's behavior like this that gets passed down, normalized, excused. This is a culture problem in Dallas, Texas probably as a whole. And a culture doesn't change with a press release. It changes with accountability, retraining, leadership, consequences, and a refusal to let people like this touch patients. So, in closing, Black women deserve urgency, compassion, and clinical excellence. This ain't it. What we saw was unacceptable, and it's time that the healthcare system finally stops pretending that this doesn't happen. You need to do better.
Any true midwife would have known that baby was coming, okay? The woman was groaning, like, that means the baby's knocking on the door, okay? You've asked her the question, what baby number is this? Baby number 3. Do you know how many times as a midwife you can be asking them the questions whilst you're helping them bring down their trousers, whilst you're taking them to the delivery room? That woman was going to give birth. And the fact that the healthcare professional did not even look at her, you're speaking to a labouring woman and you haven't even turned around to even look at her, to even see all the signs, everything, every sign she gave, the fact that she can't sit down, she had to stand up, she had to turn around. Every sign gave that baby was coming. And even if that baby came 12 hours later, it doesn't matter. That's not how she should have been treated. So when we go on about Black maternal health, people think we keep going on. This is what we mean. And what you just saw isn't something that happens randomly. This one just happened to be filmed. That video disgusts me so much.
Hello, TikTok family. This is a follow-up on the video that I posted earlier. So I was at work. I had no idea of the activity that was going on. My daughter's texting me, calling me. I didn't know what was going on. So finally I get home, they tell me about the video, and a lot of you was asking about a follow-up and to explain the situation. So this is the situation. My daughter went into active labor at home. We took her to the hospital. She called ahead of time, so we know they are expecting us. However, we get there to the emergency room, we watching nurses, putting gloves on, running to the door. They get outside of the door, and I drive a black SUV, and they look at my vehicle, and one of the nurses come up to the window, and she goes, I'm sorry, this is for ambulance only. I said, well, my daughter is in active labor. And she was like, okay, she said, but you're going to have to go to the front. I'm like, I have to drive to the front. And they said, yeah, you have to drive to the front. Okay, another redhead. And so I'm like, so she's in the, you hear, and it was like, yeah, she started bagging up, hit the button, went back inside the building. So I go around to the front. I get out of the car. Again, this girl is in more pain now than she was when we first left the house. And she started saying, I feel pressure. I said, take deep breaths. I ran in. I said, hey, my daughter's in the car. I went to emergency. They told me I had to come to the front. So the lady was like, what's your daughter's name? Told her Kiara Jones. She gets out some paperwork, started typing in the name. I was like, ma'am, do you have a wheelchair or anything? She's in the car. I need to get her in. Oh, if you check on the other side of those doors where the vending machine's at, there should be a wheelchair out there. There's no wheelchair out there. So she gets up, she walks in the back, and she come to the door with a wheelchair. She said, here you go, ma'am. I said, excuse me, you're not going to come with me? And she was like, no. Oh, okay. So a police officer was in the lobby. He gets up. He grabbed a wheelchair. He goes out the door with me. He said, come on, I got you. Went out there. She is on hands and knees in the back of the vehicle. And I'm like, oh, shit, what is going on? And then she goes, it's in my ass. And I was like, what? And the guy was like, and she was like, he said, okay. She was like, give me a minute. She could not move. So when that contraction eased, we put her in a wheelchair. He said, you can go park your car, because they, again, had people out there. So I went park my car. It wasn't even 30 seconds. I run back in the building. She's just there with a stack of papers in her hand, screaming that this baby is coming. This baby is coming. I look at the registers behind the window, and they looking at me, and they was like, well, we can't do anything until she signed the papers. Are you fucking kidding me? So I grabbed the papers, and of course, it's all they ER bullshit that they have. And I was like, you want her to sign this, and she's in active labor. And they was like, okay. I was like, ma'am, she was supposed to be induced earlier today at 8 o'clock. And they called and told her that they will call her because they didn't have beds. And they will let her know. And no one ever called back. They called back every hour on an hour. And it was like, no, we'll call you back. And then finally, her water break, she called them. They tell her to come in. So why is she signing these papers? We need her in labor and delivery. And it was like, ma'am, I'm sorry. So the charge nurse comes out. And she saw the paper signed. What fucking, are you serious right now? And she closes the door. And then the lady behind the window at this point, my daughter, scribbled her name on all the papers. We gave it to her. She says, thank you. She walked it around to the charge nurse. She opened up the door. My daughter is literally like having a contraction. And she's just standing there in the door. So we push her into the door. I said, can we get her into labor and delivery? She said, no, we have to fill out all this paperwork. I have to do the paperwork and get her a band before we can send her upstairs. So that was the video that you guys saw that I initially posted. So the next video that has no picture on it was when I was pushing her in and we was at the window because they asked me to move her from the window so they can take care of the guests or, patients that was coming in and out. Do not go to this hospital. This hospital is ghetto as hell. They do not care about Black women or their babies. This is crazy. I read about stuff like this all the time. But to see this firsthand, this lady did not care. None of them. It wasn't until we got into labor and delivery where we saw an ounce of care or sympathy for her. Before then, they can care less. She did not care if she gave birth in that wheelchair. That was not her problem or her concern.
I'm watching this clip of a Black mother, and I will show you this, in active labor at Dallas Regional Medical Hospital in Mesquite, Texas, and my stomach is in knots. She is screaming, she can't sit, she's doubled over in pain. Anyone with eyes can see she is in active labor, and instead of being taken straight to labor and delivery, she is stuck in that waiting room for over 30 minutes while someone registers her like she's checking in for a dental appointment. So here's the clip.
When's your due date? Right now. Is your due date September 11th? What? How many times have you been pregnant? 3. This is your 3rd pregnancy? Yes. You have 2 babies at home? It's in my ass. You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the Black ones?
Everyone's like first another patient for you. Alright, last name is Jones. She's G3P2. I'm not sure when her due date is.
Her due date is the 10th.
I think her due date's the 10th.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors. Everybody say how they treat people here.
And the healthcare professional sitting right there doesn't acknowledge her pain at all. No urgency, no assistance, no call to labor and delivery, nothing. 12 minutes later, she delivered her baby. 12 minutes. So that tells you everything and exactly how close she was when she was left out there in agony. People love to pretend medical racism is some historical artifact, but this is exactly what it looks like today. This is how Black mothers die. Our pain is dismissed, our symptoms are minimized, care is delayed until it's almost too late, and then everyone acts shocked at the maternal mortality statistics. There is absolutely no universe where this is acceptable patient care. Active labor at that stage is an emergency. She should have been immediately transferred to labor and delivery, full stop. And if this is how she was treated before delivery, imagine how she may have been treated postpartum. And that is truly what scares me. I hope that this young lady and her baby are safe, but this cannot keep happening. Black mothers deserve better, and the system knows it. It is long past time to root this out entirely.
Guys, as you continue watching, this story is bigger than one nurse. It speaks to a system pattern of racial bias in maternal health care that continues to impact Black mothers at alarming rates. Guys, stay tuned as we continue unpacking the full story and shine a light on the fight for accountability, dignity, and justice. Let me know your thoughts in the comment section. Stay tuned. I'll be coming back with more commentaries.
I don't know if you guys have seen this footage, but this is not okay. I am absolutely mortified after watching this for many reasons. Let's just talk about the fact that I'm an ER nurse and we are supposed to take care of patients. I cannot imagine somebody walking into the emergency room that I'm working in and they are screaming and we know they're in active labor and we're just ignoring them essentially and asking them questions that we can get on the back end. We can get on this app and we can play and we can joke and we can do skits, but one thing I take extremely serious is patient care. And aside from that, let's talk about the fact that African American women are at high risk when giving birth, okay? A study from the CDC shows that for every 100,000 live births, there has been 50 fatalities in African American women, putting them at a 3 times higher chance of fatalities than Caucasian women. So for every 100,000 births, live births in Caucasian women, only 14 fatalities. Not saying, right, that this has to be about race, but it should put an emphasis on the lack of urgency on a patient who's at higher risk. My heart goes out to this mother. I am so sorry you experienced this, and I want you to know that all healthcare workers do not look like that. We actually don't claim that kind.
This video should piss off anybody that sees it, and then it just falls on what I talk about. If you are not passionate about being in the medical field and taking care of people, then you should not be in the medical field. This nurse lacked empathy, sympathy, everything that she needed to take care of this mother who literally was just about to give birth. The amount of pain that you're in right before you give birth to, those contractions, everything, it feels like your bones are breaking, and she's asking her questions. I have no words. It is truly disgusting, that video, seeing how they, she took care of her, the lack of urgency in the whole situation. And I hope this video gets the attention that it needs, that it deserves, because people like that should not be in the medical field. I'm so tired of it. I dealt with it all the time when I was going through my cancer treatment. And I've watched the lack of urgency with my sister who was having a seizure from the paramedics. It's just disgusting what's going on within like our medical field, the way they want to get your insurance, they want to get all your information first, and then I'll take care of you.
Yeah, family, buckle up because this story is one of the most disturbing, heartbreaking, and infuriating cases that we've seen in a long time. Just out of Dallas Regional Medical Center in Mesquite, Texas, a white nurse has been fired, and they're saying the license should be revoked because the hospital is now facing a major lawsuit, all because of how she allegedly mistreated and neglected a black woman in labor. And let me tell you right now, the details are not easy to hear, but they must be heard. Guys, we keep talking about how black women are 3 to 4 times more likely to die during childbirth in America. We keep talking about medical racism, the bias, the stereotypes, the way black women are ignored when they say they are in pain. And then a case like this comes along, reminding us that this is not an exaggeration. It's not a myth. It's real. It's happening. And it almost cost this woman her life. You see, reportedly happened. This black woman, heavily pregnant and in active labor, goes to the Dallas Regional Medical Center to deliver her baby. She's in pain. She's begging for help. She knows something is wrong because nobody knows their own body like a mother does. But instead of being treated with care, instead of being listened to, instead of receiving the urgent medical attention she deserved, she was ignored, she was dismissed, she was talked down to, and according to the lawsuit, she was even mishandled by the nurse assigned to her care. The nurse reportedly left her unattended, didn't check her vitals, didn't listen to her concerns, and when the woman said she was in unbearable pain, the nurse allegedly brushed her off, acting like she was exaggerating. How many times have we had this same storyline? Black women says she's in pain. Medical staff assumes she's overreacting. Black woman asks for help. Staff delays it. Black woman says something is wrong. They don't believe her. And this time the consequences were severe. Yes, the lawsuit claims that the woman's condition deteriorated rapidly because of the nurse's negligence. Her baby was put at risk. Her own life was put at risk. When other staff finally intervened, it became clear that the nurse's alleged actions were not just careless, they were dangerous and reckless. So the family says they were traumatized, they were confused, they were shocked and terrified, and that they might lose both mother and child. And let's be real here, there is no worse feeling than being vulnerable, in pain, begging for help, and someone who took an oath to care for you decides they just won't. After an internal investigation, the hospital reportedly took action. And people are saying, some reports, that the nurse is likely to be terminated and the state nursing board moved to revoke her license if possible. So this is extremely rare. Hospitals protect their own. Licenses don't get pulled unless the misconduct is undeniable. But even that wasn't enough for the family, and honestly, it shouldn't be, because the damage done wasn't just physical, it was emotional, psychological, and it's part of a bigger problem that has been ignored for far too long. So the family decided to sue the hospital, and they absolutely should. Let's talk about the big picture. This is not an isolated incident, because black women have been saying for generations that they are mistreated in medical settings. They are ignored, judged, treated as if they feel less pain, seen as difficult when they advocate for themselves. And the numbers back it up, the stories back it up, the funerals back it up. America has a black maternal health crisis, and cases like this prove it's not about poverty, it's not about education level, it's not about attitude, it's about bias. bias, it's about racism, and it's about medical professionals who simply do not value black lives the way they should. So when this story hit the internet, the reaction was immediate. People are furious, people are heartbroken, people are demanding accountability, not just for this nurse, but for the entire system that allowed this to happen in the first place. Comments are pouring in from black mothers who experienced similar neglect, from families who lost loved ones, from people saying enough is enough. And you know what, guys? They are right. This cannot keep happening. So now the lawsuit is moving forward. The hospital is under fire and the rest of the country is watching. Because if there is a story that proves why reform is needed, why bias training matters, why we must demand better from healthcare, this is it. To the mother involved, we are praying for your healing physically and emotionally. To the hospital, to do better. To the nurse, you should have never been in that position if this is how you treat people. And to black women everywhere, your lives matter, your births matter, your voices matter, and we'll keep speaking up until the system changes. Thank you so much, guys. If you're watching this, let me know in the comments what you think, and don't forget to like, share, and subscribe for more people to hear the truth. Thank you, guys. Of course, all credit belongs to the original creators of the video. This video is meant for educational purposes and commentary purposes as well. Thank you. Be blessed. Peace be with you. Until next time, guys, lots of love.